It seems Generation X is being replaced by Generation We, consumers with a social conscience, and Red is tapping into this retail altruism.
Red is a brand designed to engage the private sector in the fight against AIDS. The business was founded in 2006 by Bono and Bobby Schreiber, with the aim to raise as much money as possible for the Global Fund to fight AIDS in sub-Saharan Africa.
Red is not a charity, it's a business, licensing its brand to iconic companies such as Dell, Gap and Apple. Up to 50% of the profit made from each sale goes directly towards the fight against HIV/AIDS via public-private health organisation, the Global Fund. So far, aided by a healthy dose of celebrity endorsement, Red has raised over $135 million by selling hundreds of products in over 60 countries.
The money that we've raised throughout our partnerships specifically goes to 4 countries: Ghana, Swaziland, Rwanda and Lesotho.
Africa is home to 2/3 of the 33 million people living with HIV/AIDS worldwide. The disease is the leading cause of death on the continent. In 2006, Rwanda became the first country to receive Red money. The $47 million contributed so far is helping fund clinics such as this one in Kigali, which serves 1,800 patients, most of them women.
Women are more vulnerable than the men, and HIV has a lot of link with poverty and vulnerability. The
clinic offers services including HIV testing, counselling, education, and most importantly, the life-saving antiretroviral treatment. In 2003, only 4 sites in Rwanda offered this treatment. Today, there are 217. Before they opened, for women like Claire, being HIV positive was virtually a death sentence.
There were no medicine. All my parents passed away. I was waiting death.
Hope was also fading for Felicity.
At the time, every hospital was full of, what can I say, it was not people. It was like a dead body lying down.
But the increase in facilities has seen the national HIV prevalence rate drop from 5% to 2.8%. Over the last 3 years in this clinic alone, the effect has been dramatic.
We don't have more than 15 cases of patients who have died, of all those people that we've been following up.
For Seb Bishop, seeing the effect Red money is having on the ground is proof the business model is working.
It shows the power of consumerism. You know, what consumers choose to buy or not to buy can drastically affect people's lives. And when you come to places like this and see the difference that we're having, it's inspiring.
In Rwanda, around 210,000 people are HIV positive, but 75,000 are now taking the 2 antiretroviral pills a day that can keep them alive, 1/3 of them thanks to Red and the Global Fund. The cost of these 2 pills is only about 40 cents a day, but more than 70% of the population of sub-Saharan Africa live on less than $2 a day. So most people simply can't afford the medication.
I'm a head of family, so I have other siblings to look after, so I'm jobless. How can I afford for those medicines?
Whatever effect it's having, some critics have accused Red and its licensees of simply using HIV/AIDS as a marketing tool. Others say they may be taking money away from charities that would spend it more efficiently. But out here, they disagree.
The beauty is that 100% of the money that's raised by Red actually gets spent on the ground.
It's not charity, it's not donation, but it's contribution. As someone makes their profit in business, at the same time they are contributing to a very noble cause of saving lives.
The work is far from done. In sub-Saharan Africa, over 4,000 people are dying every day from AIDS. Red's mission, therefore, is simple: to keep targeting consumers, making sure that every purchase in the future helps provide patients like these with a future.
I can see now my children are going to grow up seeing their mom.
So I'm still young, so the doors are open to me.